So, today we're going to dive into a pretty amazing piece of medical tech, a medicated wound dressing called Sulphachlor-Tulle. Now, this isn't something you'll find in your average first aid kit, but for some really serious wounds, it's an absolute game changer. Let's get into it.
Okay, first, think about the problem we're trying to solve here. For a little paper cut, it's easy. Clean it up, slap on a bandage, and you're pretty much done. But what about the big stuff? I'm talking about major burns or deep grazes or even chronic wounds like ulcers. Those need something way more powerful to stop infection in its tracks and actually help the body heal itself properly.
And that's exactly where Sulphachlor-Tulle comes into the picture. This is so much more than just a piece of cloth. It's a specially designed bleached cotton lino cloth that's been soaked or impregnated with a powerful antibacterial agent called Silver Sulphadiazine. And it's that 1-2 punch of material and medicine that makes all the difference.
So you can see this isn't just a passive cover for a wound. Nope, it's an active, two-part solution that's been engineered to go to work the second it's applied. It's fighting the battle on two different fronts at the same time.
So how does it actually do that? Well, first, you've got this incredible antibacterial shield. The Silver Sulphadiazine gets to work right away, fighting off bacteria to prevent infection from taking hold. Then, at the very same time, the dressing itself acts as a protective layer. It's a physical barrier that keeps the outside world out, creating a clean, safe space right against the skin. So you've got this chemical defense working hand in hand with a physical shield. It's pretty brilliant.
Okay, so with that kind of power, you can imagine it's not for just any old cut. So what are the specific situations where a doctor would reach for a dressing like this?
And wow, the list of approved uses is really extensive. We're talking about really serious situations, things like major burns and scalds, or protecting delicate skin grafts after surgery. It's also used for deep lacerations, abrasions, and even tough-to-heal wounds like leg ulcers. The one thing all these have in common is a super high risk of infection, where creating that sterile healing environment is absolutely critical.
All right, let's get practical for a minute. What do you actually need to know about the product itself, the key details, and, really importantly, the precautions? So it comes in a few different sizes, from small squares to a big roll for larger areas. But the most important thing on this slide is that precaution. Keep away from moisture and overheating. And this is a really big deal. Why? Because that silver sulphadiazine is a delicate compound. If the dressing gets too hot or wet before you use it, the antibacterial agent can break down and it won't be nearly as effective. So after the wound is properly cleaned, this dressing is placed directly on it, and you've got to make sure it's stored correctly beforehand to get the full benefit.
So what's the big takeaway here? Sulphachlor-Tulle is not your everyday bandage. It's a highly specialized tool. It's designed for the really challenging world of advanced wound care, where preventing a dangerous infection is every bit as important as just covering the injury.
And all this leaves you with a pretty cool question to think about. A dressing like this is a perfect blend of fabric science and medicine. It really makes you wonder, as our technology gets even better, what's the next frontier for healing our worst injuries? What kind of incredible innovations are waiting just around the corner? It's definitely an exciting space to keep an eye on.